Thank you so much. Hi, everyone. I'm Amber Gerrard. I work in the Yale Office of Sustainability as the Associate Director there. And I convene the New Haven Nature and Health Initiative, which is Yale's Campus RX program, but we also work with the local community and some of our community partners there. So I'm really excited just to share a little bit about that. And if you could go to the next slide, please. So just a couple of questions that I use to guide this work. It's just kind of thinking about community and who our community is, what is it that they need, and how can we support that. The next slide covers how I think about our campus community. So this is obviously with our campus CNRx program, a huge part of what we focus on. We think a lot about our students, and kind of have to differentiate between thinking about our undergraduate students and our graduate students to find that the ways to reach them, as well as the things that they are concerned about and some of their lifestyle choices, they tend to come from very different places. So we have actually engaged wellness professionals that work directly with the students and have partnered with them on our outreach programming, and we try to make it as simple as possible for the students. Especially in the last year, we've heard from the wellness professionals that our students are really suffering from high levels of anxiety and stress. Yale students always suffer from those things, but it's been particularly poignant the last year. So we've tried to just come up with really simple ways that we can remind them of the benefits of spending time in nature and to encourage them to take a few minutes and get outside. So whether that's putting together a calendar, encouraging them to look for different student interest groups that are already doing programming, our yoga groups do meditation sessions and different yoga sessions in our botanical gardens, encouraging them to get involved with local green space groups, things of that nature have worked particularly well. We think a lot about our employees too, and how we can reach them as a demographic. Our employee wellness program has really fabulous resources on all kinds of programs to actually get employees out, leading walks around town, leading nature immersion meditation sessions, things of that nature. But what we've found is that many staff members don't feel like they can take time out of their workday to participate in these programs, even though they're free and encouraged. So we teamed up with our human resources department last year to actually offer a workshop for managers, and did a session for them to talk about how spending time in nature could actually help boost their team's performance as individuals and also as groups. We actually did a session similar to the reflection session we all did earlier today with our managers, and just gave them some simple tools for how to actually bring this into the workplace through walking meetings, outdoor meetings, things of that nature that have been particularly well received. And even though we rolled out a lot of these resources pre-COVID, we found that as COVID kind of really started taking over the limelight last year, our COVID coordinator, which sends out weekly emails to the entire Yale campus community, actually used some of these resources that we had pulled together to suggest that they be used more broadly in terms of coping with the stresses and all of the things we're dealing with COVID. So if you go to the next slide, we also try to engage our research community. Yale is obviously a huge research institution, so there's so many different kind of groups and facets that are thinking about different ways to connect to nature and help in different unique ways. But I think one of the most exciting right now, one of our partners is working on thinking about how can we connect financing specifically for land conservation organizations and connect that to healthcare providers and maybe even to connected to insurance so that we can bring more and strengthen those ties between our clinical community and also land conservation community. So we've got students who are supporting our effort, acting as interns for the various components of our initiative, but also looking for ways to engage in classes that are taught and through our school of management, through our school of the environment, as well as our medical school and public health school. The next slide talks a little bit about some of our clinical partners. So when we started the New Haven Nature and Health Initiative, actually the majority of the members of the group came from the healthcare profession. So many of the faculty at the School of Medicine are also practicing clinicians at our local hospital or as part of the Yale New Haven Health System, and are really interested in how do we bring the connection between nature and health more broadly out to both the healthcare providers and also to patients. We also have really active members to some of the community health centers that are in New Haven, and even we've been recently joined by some social workers who are part of the special education programming that we offer in the city. So it's been really wonderful to partner with these folks who are really helping to get the word out to other healthcare providers. So we're trying to combine some of the resources that we develop on campus, see how they can be shared with others to encourage more clinicians to prescribe time in nature to their patients. Many of the folks involved in this are pediatricians and working specifically on issues of childhood obesity, the stress and anxiety in families. So we're trying to think a lot about what resources we can help to facilitate and make available to those folks. And park equity is one of the things that comes up over and over again around kind of these bigger systemic issues that we want to be thinking about addressing. The next slide. Just wanted to point to some of the things that we've tried to do to support these various partners. So we had some of our student interns, for example, help by adding green spaces across New Haven and also across the Yale campus to the ParkRx America platform, which is what many of our clinical partners like to use for prescribing. We're also thinking about, are there ways we can streamline this interface more directly into the electronic medical record system so that it's easier for clinicians to use. And we're also working with our local nonprofits to think about how can we better kind of be a support network. So even though New Haven has a wonderful park score in terms of access to parks, what we find is that the quality of these parks is really differs depending on what community you're from, what neighborhood you're from, and how much access do folks have to transportation, safety, security concerns, housing and affordability. So we're trying to start a lot of these conversations. How can we kind of bring various components of our community together to really grapple with this and chip away at some of these bigger issues? So finally, just at the last slide, I wanted to share that, I think what we're doing at Yale, we're thinking definitely about how can we bring nature and health programming to our students, but I think more importantly, we actually are thinking about how can we support our broader community with this effort around nature and health work. And for us, that's just by being a convening body and really trying to bring people together to have conversations, to share resources, and to kind of try to work on all of these things together. So my contact information is there. I'm happy to answer questions if there are any, or if anyone is interested in following up, please feel free to reach out.
Thank you, Amber. It looks like we have a minute. If anyone has any questions, feel free to put it in the chat or unmute yourself if you would like. In the meantime, I'd just like to say I'm so happy that you're actively addressing employees on campuses. I think that's also very important to build that nature connected community and culture, and that you're really thinking about park equity as well. And I also wanted to say I'm so impressed. All of us have been under a lot of extra stress and duress during COVID, but I'm so impressed that all these initiatives are still moving forward. So very, very impressed with that. Looks like we have one question. What kinds of resources for clinicians did you include? Cynthia Jones asks.
Thanks for that question. So we've created a box folder of shared resources that all members of our committee can have access to. So that includes research articles, information, but then we've also tried to help develop things like brochures that can be used either for clinician to clinician communication, or that they can pass out to families and communities, the community more broadly. Some of our members have been doing walk with the doc programs where they actually will take other clinicians or families out for walks in nature around the neighborhood so that the clinicians can actually kind of understand the community so that they can recommend where local green spaces are for people to spend time in, and things of that nature.